Food insecurity in Montana is a lot more prevalent than many people realize. About 1 in 10 Montanans lives in a home that experiences food insecurity. And for families with children, the risk is even greater. About 1 in 6 of our kids in Montana lives in a food insecure home.
I'm Dr. David Lechner. I'm the Vice President of Healthcare Services and the Chief Medical Officer for Blue Cross of Montana. Before I came to Blue Cross Blue Shield of Montana, I was a primary care physician here in Helena for 19 years doing full spectrum family medicine. It's a basic need, you have to eat. Food security is, ultimately then foundational for just overall wellness. Our interest at Blue Cross is we want all of our members, and actually we want the state, whether they're a member or not, to have adequate, supply, access, and composition of the food that they're able to get.
So food security and health are so intertwined that we really value the partnership and the support from donors like Blue Cross Blue Shield Montana, who help us make sure that more Montanans have access to the healthy, nutritious food that they need to ensure the long-term health of our state and our communities. Montana Food Bank Network partners with nearly 340 community organizations, food pantries, shelters, meal programs, as well as schools, meal sites, a variety of partners across the state who help to serve their communities through direct food distribution.
I'm Bruce Day. I'm the Executive Director at Helena Food Share. We've been a partner with the Montana Food Bank Network, one of their many partners throughout the state, for a number of years. It's really important relationship connection makes us part of a larger network with Feeding America. They're, really dependable. They have a schedule. We know when they're coming. They let us know. We can count on Montana Food Bank Network to help us, get the things that we need. When we think about, food insecurity or hunger in a community, it's not something that we often in our day-to-day lives maybe think about or see, that many people don't think about. Who is it that's going hungry and who needs food in our community? But what we know and what we see is that, it touches every neighborhood and in our entire community and beyond.
So my name is Alicia Buchholz. I'm the Empowerment Manager at the Montana Food Bank Network. Around 2015, I had some pretty life-changing things happen. I was a single parent, and it was hard to be able to work and go to school and provide all the things that my 2 children needed. And so I heavily relied on SNAP and other assistance programs to make sure that I was feeding my family, and I got to focus on my school, but also focus on my kids. There's a lot of things that kind of go into food insecurity because it doesn't happen just in a vacuum. There's, houselessness, there's childcare issues or access to it, being able to access healthcare. So when you're working those multiple jobs, you have to then make that choice between, do I put food on the table? Do I pay my heat? Do I pay my water bill? And that's an impossible choice. I mean, it's just a choice that kind of makes it for itself, right? You can't not feed your kids. There are a lot of people that think that people getting assistance don't want to work, but the vast majority of them, that's not the case and are usually already working.
For children, having food insecurity increase the amount of anxiety, increase the amount of behavioral health sort of, response around that. It also doesn't allow them the opportunity to learn and develop and grow like they should otherwise. Children that are chronically malnourished, do end up with different, diseases that carry on, further into life. But for children in schools, we want them to be able to get the most out of their schooling. Being hungry, not having proper nutrition doesn't allow them that opportunity to be as successful as they could be, as time goes on.
Blue Cross Blue Shield has been a good supporting partner in our community over the years. They've provided a lot of opportunities, that they are definitely a catalyst in terms of being able to provide, organizations like Helena Food Share with resources to be able to do the work we're doing. And one of the areas that I think, we've had some support from Blue Cross with our Kid Pack program. We're providing a nice little pack of kid-friendly, nutritious foods give them enough calories to help them get through a weekend if that's all they have. So it's meeting the needs of kids in our community who are at risk of hunger. We're providing kid packs to just under 20% of the kids who are enrolled in preschool, middle school, and elementary schools in Helena and East Helena districts.
We've all seen the increases in food prices at the grocery store. And for families who are living paycheck to paycheck, those increases hit them the hardest. There are so many consequences of food insecurity, not only for that family that's facing food insecurity themselves, but for our communities and for our state as a whole. So the most direct connection, of course, is health. When families don't have adequate access to nutritious food, that takes a very real toll on people's health.
You know, what gets me out of bed in the morning is to see what can we do, how can we help, recognizing that there's a lot of need for people to be healthy.
Stay busy and organized, but the real enjoyment comes with getting out and dropping the food off to all the people, getting to meet the people.